Spinal cord. Definition. It is the elongated cylindrical nervous tissue present in the vertebral canal. Present in the vertebral canal. Extends. It is about 45 centimeter long and extends from foramen magnum to the lower border of first lumbar vertebra. It extends from the lower margin of foramen magnum. Foramen means whole, magnum means large or huge. So it is the largest foramen in the skull. So it extends from foramen magnum to the lower margin of L1 vertebra. Situation or location. It is situated in the vertebral canal and it is flattened anterior-posteriorly. So it resembles your index finger. Even though it is cylindrical, it is flattened anterior-posteriorly. External features. The surface of the spinal cord presents an anterior median fissure gap. See the anterior median fissure and a posterior median sulcus. There are two anterior lateral sulci and two posterior lateral sulci. Anterior lateral sulci, posterior lateral sulci. Enlargements. The spinal cord has two enlargements. Number one, cervical enlargement. Number two, lumbar enlargement. Cervical enlargement. It is formed by the C5 to T1 segments of the spinal cord. It is formed due to the formation of brachial plexus. Brachial plexus are network of nerves which supplies the upper limb. Number two, lumbar enlargement. It is formed by the L1 to S3 segments of the spinal cord. They are formed due to the formation of lumbar and sacral plexus. The lumbar and sacral plexus are network of nerves which supplies the lower limb. The lower end of the spinal cord is conical in shape and known as conus medullaris. Near the lower end, the spinal cord contains bundles of nerve fibers. Spinal nerves are present in bundles known as cauda equina. Cauda means tail, equina means horse. Since it resembles the tail of a horse, this is known as cauda equina. Structure of the spinal cord or internal structure of the spinal cord, cross section of the spinal cord. It consists of an outer white matter and inner grey matter. It consists of an outer white matter and inner grey matter. And a central canal. The central canal is the continuation of the fourth ventricle. White matter. It is divided into anterior funiculus, lateral funiculus and posterior funiculus. What is anterior funiculus? It is the part of the white matter present medial to the anterior grey horn. Lateral funiculus. It is the part of the white matter present between the anterior grey horn and the posterior grey horn. So this is lateral funiculus. Posterior funiculus. It is the part of the white matter present medial to the posterior grey horn. The posterior white matter is divided into, that is the posterior funiculus is divided into, fasciculus gracilis, the medial part, and fasciculus cuneatus, that is the lateral part. Grey matter. It is divided into anterior grey column and posterior grey column. There are projections in the grey matter. The anterior projection is known as anterior grey horn. The posterior projection is known as posterior grey horn. In the T1 to L1 segments of the spinal cord, and in the sacral segments there is a lateral extension in the grey matter known as lateral grey horn. The two grey column are connected in the midline by anterior grey commissure. This area is known as anterior grey commissure. Okay. See, the grey matter is fully made up of neurons. It contains neurons. The white matter is made up of the axons coming from the grey matter. Okay. So, what are the types of neurons present in the grey matter of the spinal cord? The anterior grey column contains motor neurons, that is supplying the muscles. The posterior grey matter, the posterior grey column contains sensory neurons which receive sensation from the skin. Light touch, fluid touch, pain, temperature, all will relate into this area. Okay. And third one is interneurons. The interneurons are the neurons which connects these types of neurons. These types of neurons present in the grey column of the spinal cord. Blood supply. The spinal cord is supplied by anterior spinal artery, posterior spinal arteries, and segmental arteries. Peripheral nervous system. The nerves arising from the brain and spinal cord, which ends by supplying the peripheral organs, constitutes peripheral nervous system. Example: 12 pairs of cranial nerves, 31 pairs of spinal nerves, autonomic nervous system, which includes sympathetic and parasympathetic nervous system. Cranial nerves. There are 12 pairs of cranial nerves, except the first and second, that is the olfactory and optic nerves. All the other cranial nerves emerge from the brain stem. Okay. Since you have to enumerate the cranial nerve name, type and functions, okay, it is one of the university question. I am going to put it in simple words. Number 1, first cranial nerve, olfactory nerve. It is a type is special sensory. Function, olfaction, that is smell. Okay. Loss of smell is known as anosmia. Second cranial nerve, optic nerve. It is also special sensory. Okay. Function, okay, vision. Third cranial nerve, oculomotor. So the name implies that it is a motor nerve. So type motor. Function, it supplies muscles of the eyeball, that is the extraocular muscles of the eyeball. See, this is the muscles of the eyeball. There are superior rectus, inferior rectus, lateral rectus and medial rectus, and two oblique muscles, superior oblique muscle and inferior oblique muscle. So the eyeball, the muscles of the eyeball include 4 recti and 2 oblique muscles. Okay. Except the superior oblique muscle and the lateral rectus muscle, all the muscles are supplied by oculomotor nerve. Fourth cranial nerve, trochlear nerve. It is a motor nerve. It supplies superior oblique muscle. Superior oblique muscle. Trigeminal nerve. Three. So it has 3 divisions: ophthalmic division, maxillary division and mandibular division. Trigeminal nerve is a mixed nerve. That means it contains both sensory and motor. Okay. The ophthalmic division and maxillary division are sensory, whereas the mandibular division is a mixed nerve. That means it contains both sensory and motor fibers. Okay. Ophthalmic division, okay, function. It supplies skin over the forehead, eyelids, and lacrimal gland. Maxillary division of trigeminal nerve. It is also sensory. It supplies skin over the middle third of the face. Middle third of the face. And teeth and gums of upper jaw. Teeth and gums of upper jaw. Okay. Mandibular division. Since it is a mixed nerve, it has both sensory and motor. Okay, sensory. Okay, it supplies lower jaw, teeth and gums of the lower jaw, that is the mandible, teeth and gums present in the mandible, and it is sensory to the anterior two-third of the tongue, that is general sensory. Okay, so that is the sensory part. Motor, it supplies muscles of mastication, which includes masseter, temporalis, and medial and lateral pterygoid muscles, which are responsible for side-to-side movement of the mandible. Abducent nerve, it is the sixth cranial nerve. Okay, it supplies muscles of the eyeball, that is the lateral rectus. So the abducent nerve supplies lateral rectus. Injury to abducent nerve results in the medial splint. Facial nerve. Okay, it is a seventh cranial nerve. It is a mixed nerve. Sensory. Okay, a branch from the facial nerve known as cauda tympani. Okay, it is special sensory to the anterior two-third of the tongue. That is, it carries taste sensation. The trigeminal nerve is general sensory for the anterior two-third of the tongue, whereas the facial nerve is special sensory to the anterior two-third of the tongue. Motor, it supplies muscles of facial expressions, anterior belly of the digastric muscle and the mylohyoid muscle. Okay, it also supplies the occipitofrontalis muscle. Vestibulocochlear nerve. Okay, it is a eighth cranial nerve and it is type is special sensory. Okay. The vestibular part is responsible for maintenance of the equilibrium of the body, whereas the cochlear part is responsible for hearing. Glossopharyngeal nerve, the ninth cranial nerve, glossopharyngeal nerve. Glosso means tongue, pharyngeal means pharynx, so it supplies both organs. So it is a mixed nerve. Glossopharyngeal nerve, okay, it is sensory to the posterior one-third of the tongue. Posterior one-third of the tongue. Okay, and it supplies the stylopharyngeus muscle of the pharynx, that is motor. Stylopharyngeus muscle of the pharynx. Vagus nerve, it is the 10th cranial nerve and it is widely distributed nerve. Okay. Since it is a mixed nerve, sensory, okay, it supplies mucous membrane of the larynx, pharynx, okay, and it also supplies the esophagus. Okay. Motor, it supplies muscles of the larynx. Okay. It also supplies visceral organs like heart, lungs, okay, stomach. Accessory nerve, it is the 11th cranial nerve. It is motor. It consists of two parts: cranial part of accessory nerve, spinal part of accessory nerve. The cranial part of accessory nerve supplies muscles of the palate, except tensor palatii, and the muscles of the pharynx except stylopharyngeus. Spinal cord of accessory nerve. It supplies sternocleidomastoid muscle and the trapezius muscle, the two major neck muscles. Okay. Hypoglossal nerve. It is the 12th cranial nerve and it is motor. Okay. It supplies all the muscles of the tongue except palatoglossus, which is supplied by cranial part of accessory nerve, that is the 11th cranial nerve. Spinal nerves. There are 31 pairs of spinal nerves. Okay. It includes 8 cervical nerves. Okay. In the cervical region there are 8 spinal nerves. Thoracic region includes 12 pairs of spinal nerves, lumbar 5, sacral 5 and coccyx 1. So that totally there are 31 pairs of spinal nerves. So let us see how this spinal nerve is formed. So this is the spinal cord. Okay, you have grey matter, inner grey matter, outer white matter and a central canal. See, the spinal cord has two roots. One is ventral root and another is dorsal root. Okay. There is a ganglion present in the dorsal root known as dorsal root ganglion. Okay. The ventral root and the dorsal root contains axons arising from the grey matter. Okay, axons. Actually, these are the axons arising from the motor neurons present in the anterior grey column. Whereas the dorsal root has axons arising from the dorsal root ganglion. Okay, dorsal root ganglion. It has a central process and a peripheral process. So, the ventral root of the spinal cord and the dorsal root of the spinal cord joins to form a single spinal nerve. So, the spinal nerve is formed by the ventral and the dorsal root of the spinal cord. So the spinal nerve has both motor fibers and sensory fibers. So spinal nerve is an example for mixed nerve. Typical spinal nerve. The spinal nerve arising from the spinal cord emerges out of the intervertebral foramen. Between the two vertebrae on the either side you have intervertebral foramen. So they emerge through the intervertebral foramen. So it is coming out. It divides into an anterior primary rami, APR, anterior primary rami and posterior primary ramus. PPR. Ramus means branch.